Today is Monday, May 18th, up to now, Monday, May 18th, 2020. It's 7:01, and we are here at the National Palace in Mexico City. We're going to get started with our daily press conference on COVID pandemic, the new epidemic in Mexico caused by SARS-CoV-2. I'm going to start off with the technical report, as we do every single day. Right now, we've just had a little delay. We're going to see if people from the Secretary of Labor and the National Health System can join us. We're going to give you some information formally tomorrow on this to talk about protocols in terms of health measures that we're going to be taking at work. We do have some advances on what these protocols are going to be, especially for companies who are involved in specific productive sectors. For example, automobile, furniture, and construction. And we want them to continue with the work that they're doing, but we want to also deal with their questions and concerns and yours as well. And I'm going to tell you that more about this in a moment. Let me stand up. If we don't have our colleagues from the Secretary of Labor and the Mexican Social Security Institute, that's no problem. I can speak with you. We are on day 17 of this month's, we're talking about the National Safe Distancing Campaign, and we have been very clear about everyone in all of Mexico, in every single state, in every single municipality, except for the municipalities of hope. And this is where our safe distancing campaign has not ended. We have until May 30 for our national safe distancing campaign to end. So I want to remind people who might think that this social safe distancing campaign is over. It's not. All work that is not classified as essential is postponed right now. And that is according to the Ministry of Health. And we had that published in the official gazette of the Federation. Any areas that are considered essential, they continue to work. Everyone else who does jobs that are not essential must have their businesses closed. Another thing that we've been worried a little bit less about is the educational sector. We canceled classes at every single school, public, private, social. They're all closed. They're all going to be closed until further notice. Now, about social activity and recreational activity, which mostly occurs in public. Public is everything that isn't your house, basically, just for practical purposes to let you know. When we have private companies as well, I mean, those are private, but we're talking here about where big crowds get together, like museums, concerts, movie theaters, parks, recreational areas. All of this is closed. We cannot have people getting together in big crowds. We can't have people on beaches. We can't have more than 50 people together. That's our national safe distancing campaign. That's what it means. We still have almost 2 complete weeks, and these are so important right now, especially as our colleagues at the Mexican Social Security Institute will be coming here to tell us, because we are at the highest levels of transmission for SARS-CoV-2. I would like to close this up, this introductory part, by saying that when we do end our national safe distancing campaign on June 1st, the 31st of May is Sunday, so we're going to have a little transition period there. On June 1st, I don't want everyone to think, please let this be registered very clearly. On June 1st, we're not going back to normal. We're not going to start up all our activities to do. No, we're not doing that. That's not what's happening. Here's what's going to happen. In each state, in every single of the 32 states, before June 1st, the weekend before June 1st, Monday, June 1st, we're going to show you which state, we're going to show you every single state and how COVID is doing in that state. And we're going to use an epidemiological risk stoplight to let you know where people fall red, yellow, orange, or green. So then you'll be able to see, according to what state you live in, you'll be able to understand what the COVID situation is there. And we'll be giving you instructions about what sorts of activities will be opening up again, what sort of work activities will be opening and which ones won't. Please do not think that our national safe distancing campaign has ended on June 1st and that on June 1st, we're all going to run out of our houses and go right back to normal. Now, exactly today, what we're going to comment on is the new normal, and we're going to talk about this transition to the new normal. We are going to get back to work and recreation. It's going to be staggered, supervised, organized, and safe. It's going to be safe in terms of how we are, what kind of measures we're taking to not be infected with COVID. Let's go to our technical report. Worldwide, we have 4.6 million approximately people, total confirmed cases worldwide. That's 4,618,821. These are mostly testing cases that have tested positive from labs. And we also have 1,182,990 cases, 26%, which is the active part of the pandemic, which are the confirmed cases over the last 14 days. Right now in America, we have the highest burden of disease right now. Following us is Europe. It's descending quickly, but please don't lose sight of the Eastern Mediterranean, which had a little bit more than 10.6 before, if I'm not wrong, and now we have 11.2%. And we have our global fatality rate as well mentioned there. In Mexico, we have 51,633 cumulative confirmed cases. These are people who have COVID since the pandemic started in Mexico on February 21st, when the first case was detected. We have 11,300 confirmed active cases. These are cases from the last 14 days, and you can see that recent cases are increasing. So this is a very active pandemic, even though in some cities for a number of weeks, they have seen a decline in the daily number of new cases registered. But other places like the Valley of Mexico is showing us relative stability, but it's also has a very high occurrence incidence rate of new cases. We have 5,332 people who unfortunately have lost their lives. They have been hit by the most serious type of COVID. There's a spectrum. Some people, fortunately, the majority of people, we estimate around 8 out of 10 people, they only have a non-serious version of COVID. They have a sore throat, red eyes, they're sneezing, and other symptoms such as these. But then we also have up to 20% people who have been hit by COVID that is a more serious version of it, and they have to be hospitalized. That's 20%. And 5% of those people end up in the ICU on a ventilator, as well as with other life saving mechanisms. 177,133 people have been tested, and we have 26,933 cumulative suspected cases. And then we have 98,567 cumulative negative cases. Next slide. Here's the map. This is the history of our pandemic in Mexico. There isn't too much change here in terms of the distribution among states. But today we can see that some states are in a darker red color here. The Valley of Mexico was that way before, others weren't. So the prevalence rate has increased, which talks about the number of cases for 100,000 inhabitants. And right now we're at 40.4% for the prevalence rate. And we also have the same information presented as a bar graph. You can see how the states each have a number beside them. You can see how 14,566 have COVID in Mexico City and the surrounding area in the Valley of Mexico. That's followed by the states that are shown on this slide. And then we can see the new burden of disease over the last 14 days. Why is this important that it's over the last 14 days? Because that's the estimated period as an average for people getting affected, for being able to infect other people. We see 11,300 people who have confirmed active recent cases. The distribution here shows us that some states do not have a high transmission rate. For example, Baja California Sur, and other places are having as well having a reduction in terms of how many new cases they have. But people, and then some people were in dark red and now they're in orange. So the burden of disease is going down. For example, Quintana Roo has less than 500 cases now, active confirmed cases. Here's the same information, the recent burden of disease presented as a bar graph. And you can see that the Valley of Mexico there represented on the far left. And then we have Mexico, Tabasco, Veracruz, Baja California. And then we see Quintana Roo, which used to be in fourth place, and now it's over in yellow. They've had really great control over there in Quintana Roo. And I want to say good job, excellent job to the health authorities over there. They maintained extremely strict control. They reduced mobility down to more than 85% of what it was in public. And that has meant a public health success. It doesn't mean that transmission levels are null there, but I want to say my respects and recognition to Governor Carlos Joaquin and the Secretary of Health, Dr. Alejandra Aguirre. 8.84% incidence rate per 100,000 inhabitants in Mexico. This is the percentage of people who have had COVID in Mexico over the last 14 days. This incidence rate enables us to be able to compare with other incidence rates and how we can identify exactly what number we're going to have for an estimated incidence rate in each state. Mexico City, again, for the third day in a row, is up at 30 per 100,000 people. And then we have Tabasco down at 25. The state of Mexico has an incidence rate that we consider minor when we take a look at the population density, because it's one of the most populated states, the second, in fact, so it represents quite a bit. But here, when we look at the incidence rate, we don't have a significant burden of new disease there. Next, we have the fatality rates, and this is for the 5,332 people who very unfortunately lost their lives, but we see that represented here as a bar graph. We have 656 suspected deaths, and this changes every single day. It's not the same, as some cases get confirmed, others are confirmed not to be COVID. So this changes every single day. When we take a look at by state, we can see the distribution that has not changed very much since the beginning of the pandemic over the five states that are on the very far left of the bar graph. Basically, this is irreversible that they will maintain that position. Over here, we have the confirmed cases, the suspected cases represented as a bar graph. Now, if they've been confirmed or if they're suspected cases, they still are represented here and give us an idea of what's going on. And here we see the date of when they started exhibiting symptoms. Why am I underscoring that? Because we want to know when they started exhibiting symptoms, on exactly what date, to see how long they were exhibiting symptoms for, so that we can see that at that same point that some people began to exhibit symptoms, some people exhibited 3 days before, 3 days after. So we always have to keep in mind when we're taking a look at a graph like this that shows the onset of symptoms, that this graph is going to constantly change. If we have someone new and we register them today because they started exhibiting symptoms, we're going to register them today. But then they would say, well, I actually started exhibiting symptoms on this date or that date. So that's why this graph changes continually. Finally, this is the epidemiological curve, the epidemiological report of cumulative cases and daily increases. Yesterday, we had an increase of 4.4. Today, we have an increase of 4.9%. So this percentage lets us know with that number of cases that are confirmed, those 2,414, those are the cases that have been added over the last 24 hours. So we are following this very closely, and we see that the transmission rates are high and active. Let's take a breath and let's take a look at occupancy rates. For occupancy rates, we have 739 reporting COVID hospitals from our network that are telling us about their occupancy rates. So the beds that are occupied are 39%, 8,862 beds that are taken. Here you can see the occupancy rate at the bottom, and then in the beige, you can see the availability rate. You see that each column, as I said, shows you nationally what the occupancy rates, and we can see by state what percentage of their beds are available. So we have Mexico City, State of Mexico, Baja California, Guerrero, Veracruz, and Tabasco in the first places. And then we also see what patients each of these states have in ICUs, 32% nationally, and 66% in Mexico City, followed by Baja California, Mexico, and all the way down. I think that's the last slide. Maybe was there one more? When we talk to you about occupancy rates, people ask us, okay, well, how many hospitals are there in the COVID network of hospitals? But this changes. The number of hospitals who are within that reporting network changes, because we also have been expanding how many hospitals we have. For example, in Mexico City, we started with 5 COVID hospitals, and those were part of the hospital network for the state of Mexico. There were 5. There are many more, like from the Mexican Social Security Institute, ISSSTE, Pemex, etc. So we're adding more hospitals all the time to that network. On April 24th, this is just a day that we cut off. This doesn't mean that this is when things started. But here we see which hospitals start to be officially designated as COVID hospitals. We started to have more and more, so we had to readjust because we hadn't received the ventilators that we thought we would. So we didn't have the capacity for those hospitals to be COVID hospitals. But we did manage to get that back. So about 8 or 10 days after that, on May 12th, We did continue to increase the number of hospitals that we had. Now we're going to take a look at the number of beds, which is also very important to understand. And just to let you know, this is national perspective. First, we had 6,900 beds. Then we had 14,500. And when we're talking about ICU beds and general hospital beds. And we've had some change here depending on whether ventilators arrived or not. We had to kind of pull back our predictions because we didn't get those ventilators. But we are far, far away from our hospitals being full. We have a 39% occupancy rate in general for national beds. Right now, on May 17th, we have 22,600 general beds, and you can see the other ICU beds. Is that the last slide? Okay, wonderful. Let's give a welcome. Welcome, Dr. Mauricio Hernandez Avila. He is the director of loans at the Mexican Social Security Institute. He's here to talk to us about some things that we have been very arduously working on since last week. The subject, reopening the economy. We have said that those three sectors, creating automobile parts, manufacturing, right? The automobile manufacturing sector, construction, and furniture making. And sorry, mining, construction, and the automotive industry. These three sectors have been considered to be essential at this point. We agreed on this last Thursday, last May 14th. We designated those sectors as being essential, and we had to publish information on this on May 15th to say that these sectors would not jump right back into manufacturing, because in order to start up manufacturing again, they need to have health protocols in place. And this doesn't mean you just write a little book and have a guide. No, it means you need serious protocols. So in order to make that decision that we did, we've been working on this for weeks with a multi-sectorial group. And this also comes from the agreement that we signed on March 31st that said that after the National Safe Distancing Campaign would end, the Ministry of Health would work hand in hand with the Ministry of Labor and the Ministry of the Economy, and that they would establish what the conditions would be to, in an organized way, ramp up the economy again. Now, the Mexican institution that has the most experience with health and hygiene at work is the person who's going to help us with this. I think we have coordination, don't we? Oh, and today this is tied to Dr. Hernandez's area. So to wrap this up, over the weekend, we had some very productive conversations with numerous sectors, and we talked to them through their representatives at each of their chambers. And we also had the Secretary of the Economy there, who was going to be working with the other ministries, social service, labor, and economy, as well as health, to talk about how we need to have a mechanism that guarantees that people register early protocols that are going to be in place, and that these protocols need to be in line with health protocols that have been laid out by the federal government. And they all need to be working together, as I said, with the Ministry of Labor and the Ministry of the Economy. And each of these protocols must be implemented. Secondly, this needs to happen without bureaucracy and with everyone aiming to achieve and put these back into place and get this done organized and in a very safe way. And this is what Dr. Hernandez is going to talk to. And he has been designated by this whole work group to coordinate this operation. Thank you so much, Dr. Gattel. Oh, I can't say that I was late because of the traffic, but I am very sorry for being late. Good afternoon, everyone. I am so pleased to be here with you. I'm glad to be here to talking about reactivating the economy with you. Why? Because we're thinking about how we're going forward in controlling the pandemic. And it's nice to be able to think about how we are going to restart our economy. The Mexican Social Security Institute is very interested in this equilibrium that we have to achieve to make this happen. The Mexican Social Security Institute maintains itself from the quotas that people pay to it, the government, companies, and people themselves. And this is directly tied to people's job. So if there are no jobs, so if there is no economic activity, then, well, our finances are damaged. If there is economic activity that is not regulated, and then we jumpstart things again and people start to get infected at a faster rate, then we're going to have more and more patients in our hospitals. And that has a high cost, a human cost, institutional cost, because our institution has to make those beds available to people who are ill. We also have to postpone the health attention that we're normally giving to people. Equilibrium, as I said, it's complicated. Now, what we have been suggesting from the Institute is a series of principles and a series of rules, which I would like to present to you today. Look at the principles. We need to put health and human first. All of us are aware that this is very, very important. The second thing is a moral economy with productive efficiency. This is an economy that takes care of people's health, of its workers' health, and is careful with their health, and that has to adapt to the new normal. Because at the moment that we start up the economy again, we're starting up an important focal point of transmission for the virus, because we're starting transportation again, where people have a lot of contact with other people. And we also have another chain of transmission that we're kind of setting off, which is the work environment where people actually are at their jobs. The other principle is solidarity with everyone, not discriminating. Here we considered that, for example, vulnerable groups of people, or people who have had COVID, or people who live with uncontrolled chronic diseases or high blood pressure, for example. Here, what we're asking for employers is not to fire or marginalize these people. For example, people who have these types of underlying conditions. And as you know, all the educational activities now are at home. Women are the ones who are most involved in supervising and taking care of children at home. So we're also asking companies who have women as employees, don't fire them. There has to be tolerance.
So, and is this is in this regard. So, and of course, there's a responsibility, a joint responsibility with the public. So we have three different axes of action. One is the surveillance of the epidemic, and here I'm going to talk about this surveillance that we have in the institute for disability, temporary disability. Um, I will be addressing this more deeply in how we are minimizing the transmission rate and the work environment. And not going to talk about medical coverage, because Victor Borja, the doctor, has already comment over this. So these are the visualization that we have of the disability. It's a lot of data that we show here, but these are data that we have available since 2009 up to 2020. So, and what do we do with this data? Well, with this data, we can have a history within the companies, how good they are in order to be able to decrease those infection chains. We can see the transmission of the epidemic in the country, and we have the disability related to COVID. We can see it clearly here. With regards to states, so we have the national picture, we have the state picture. This is a live map that we have, which includes the data of the disability per state. And finally, we have here the history of one single company. And what is the important thing in this graph is, if you can see here, you can see here when the winter starts, and you can see here the current weeks of the month of May. We can see how during the winter it wasn't really bad, the season. We can see now the last weeks, which is we can see the epidemiological outbreak. We have a few days, and a few days the number is 90. We have the scale here, which is 30, and now we can see here, as it's been classified, this green color means that now that the doctor confirmed that it was COVID. So this graph here helps us to identify within the companies how their protocols, if their prevention protocols within the company are working or not. So you might think, and how are we going to know if they're being infected in the company or not? So we're all at risk of infection, but the thing here is that when we get to our workplace, we can represent a source of infection. So if we didn't have an association here, we would be 1, 2, 3 cases, 1, 2, 3 cases. But as you can see here, there are moments in which these cases occur at the same time. They are out of expected frequency. And this way we can see how in this week we had an outbreak. So this will allow us to study the company. Each company has a bar like this, a graph like this, and we will be able to visit these companies or talk to to our friends in the Ministry of Labor and tell them, why don't you go visit these companies? Because it seems like they might not be following the protocols. Next one, please. As you can see here with maybe more detail, this is the map by states. And as you can see here, you won't see the usual states. You can't see Baja California or the State of Mexico or the State of Mexico. You can see here Tabasco and Nayarit. And why this difference? Because what we are analyzing here is the sector, the construction sector. So there's not in these other states, there's not a lot of construction. Only in Baja California Sur, Nayarit, Tabasco. That's where we can see those that high number of disability. So that's where we can see. We have to see. We can zoom in this area. We can see what company we're talking about. So here's the global map. We have the different companies in the construction sector. We can identify. In the country, it's been 10,000 cases of breathing conditions. We have a number of cases that have been already identified as COVID, 2,496. Some other that have not been identified. And these numbers are from January up to the last week of April and the first week of May. This system has 2 days, a delay of 2 days. which means implies when the employee requests the disability and when he starts the process. And the next one, this black dot here, this area says here activity, essential activity, and it shows the name of the company. I won't disclose the name of the company, but we can see the history here, and we can tell how the numbers are very high. Within the past week, since the 20th, it's been really high. So we can see that there's not a really good behavior in this company. If we zoom in, we can see 1, 2, 3, those are the weeks. And you already know this because Dr. Lopez Gatel already talks about the epidemiological weeks. So we can see how in this company, there's a high transmission rate. There are days in which, or weeks in which they've got 40 employees from at the same company who sought requested a disability. So this allows us to have to be able to take a look in the companies, and this is what we'll be using to address the behavior of the different companies. This disability, for those who are not maybe familiarized with this because you're not insured, this is a temporary disability for employment. If I have influenza symptoms, I go to my family doctor, he gives me a diagnosis of influenza, he gives me a disability, and that disability will allow me to have a some temporary benefit, which is the 60% of my usual wage, and that will allow me to go through this um, uh, period of disease. So if he'll have 100% of his wage, because if it's influenza or COVID, that means that it is an employment risk for the doctors. So this is how we are going to be having the surveillance over the impact and those chains for infection. And we are going to be addressing that in relation to the stoplight that the health ministry will be providing. We expect to have a healthy return, gradual, organized, and with cautious. And with this, we are using all the experience of the institute in terms of the working environment. What we are suggesting here is some measures, which is like the ABC of what is the hygiene measures at work. Some engineering measures, and this means that I can maybe um, work by blocks maybe, and I can keep, if I don't have a way to maintain the safe distance, I can use maybe some acrylic wall to keep employees separate from each other, therefore decreasing the infection risk. We can have some other management measures, which may mean having a filter at the door of the working place to check with temperature checks, with a questionnaire with regards to symptoms, and have a very clear policy of employee who has or signs of COVID. They might just want to stay at home or go back to stay home or go back home to avoid being a source of infection. We can also see the measures in terms of PPE, which is the use of masks, gloves, boots. We have sanitizing policy, which means measures with regards to the use of sanitizing gel, cleaning the areas, and we also have now the education of staff so that we can all know and be aware of what this all means. And of course, this is all uncomfortable, these measures. Maybe we don't like the fact of not being able to eat with our coworkers or talking to them, but it is very important for the employees to be educated so that they can adhere to these measures. So this education, even though companies have it, we're also doing this through the institute on our website and our online platforms, which has been already visited by over 1.5 million people. And this is only with regards to the measures related to COVID. And we also have some other resources for each different industry, for different companies from different sectors. So this is what we've been working on, and what we have available on our platform, along with of working along with the Ministry of Labor, with Alejandro specific, and this is an evaluation that considers these measures, the safe distance, the engineering control, the management controls, and the use of PPE. Of course, the companies will has to let us know what their plan is to use these resources that they have available. And I stress this is the ABC. So this applies for construction, for the automobile industry, for the mining industry, and in different ways, of course, but under the same concepts. So, for example, some actions for education or training in terms of advocating for health. So people have to know that going to work with some respiratory symptoms in this pandemic is it's just a no. It's just worse than sneezing and not covering your sneeze. So imagine that you have an engineer, a doctor who goes to a hospital with COVID symptoms. So this will just create an infection, a transmission chain, terrible. Same it is in a hospital that it is in an automobile factory or in any place for work. So the point here is that people have to be aware of what the COVID symptoms are, what the protocol is, and they have to know what the transmission chains are so that we can protect ourselves and we can have. And then we have the care at home. When we're isolating at home, so we have 30% of the infection rate at home. And when we will go out, that decreases, but then we have work, we have transport, so we have different numbers there, and it's very important. So we have the engineering controls. These are some examples. We don't have all of them. Some companies have video surveillance systems, which we let them see what is how close employees are. There's even an app available for some companies in which they get a warning when they are too close to other cell phone. And there are some situation in the working place, ventilation systems, that's very important as well. The physical barriers, which we were talking about, and also the sanitation symptoms and the protocol for protection for shoes. So we have the administrative control, which is like I said, having filters maybe or some policy for those detected cases. It's not only about sending back home that person who is a suspect, but we have to apply if there are symptoms or not, if they are might be granted or they're eligible for a permit, if they can need to go back to the doctor, if they need to go back to their home, but with the appropriate protection, so that this employee doesn't represent a transmission source. For transportation, we've been working really close to the automobile industry, and we've learned a lot about them, how they are doing. This is a transportation. There is a temperature check filter. You can see the employee wearing a mask maybe, and there are spots in the bus that are assigned to the employee so as to keep a safe distance. There's also the access points with a mark so that you can differentiate the exit and the entrance. There's also those places where you have the alcohol gel, the sanitizing carpets with some chloride. You can see here as well some of these barriers that have been already put in place. I don't know if you're able to see on this slide. These are some open offices. They can be really, there's no a meter and a half between them, so we have a barrier. And this is not fun because you might feel more like trapped, but this is the new normal. And they have to be educated to actually demand this new normal because this is for their own protection. We can see the lockers here, and we have another area with lockers with their appropriate marks to keep the safe distance. They also need to have the information to keep in mind and remind the employees of the COVID situation. And well, this is some, this is for the course at claims on our platform. I really encourage you to access it. You can access it very easily from the Google search engine. You can access it easily, and it is an education platform, and it's a platform that has a lot of games that will help with the education and the learning. Um, these games show different situations, different scenarios with regards to the transmission areas, and also um, different resources that are very helpful. So this is how what we wanted to explain and go over a little bit, so that we don't want anybody to be less than 1.5 meter close to a different person for more than 10 minutes. And this is this safe distance that we have to keep. We also have, and we're also developing, we are we are translating these guidelines, or we are making out these guidelines some educational material for all people from different industries, people working in barbershops and restaurants and driving taxis. These resources are also available at Claims. We can, and anybody can download these resources. They all have about the same format, and what we do is just adapt these engineering measures and management measures and for the sanitizing measures to the different contexts in which we can have this. I have the clean slide here again. Okay, so we have now 1.5 million subscribers in 4 months. There's a 75% success rate in terms of those who finish the program. It's a very friendly platform. Dr. Gatil knows about it as well because we used this the last time, maybe not as good as today, but we also used it. Now, for the recommendations for the safe work environment, we put it up just 12 days ago and a couple of days ago, and we have plenty of visits already. So again, it's a very friendly platform that everybody can access. So for the transmission chain, this is something that Dr. Gatil suggested that we included in terms of transportation. And we are considering here transportation also as a company, because they have employers, employees, and users. So we are having here the entire verification system so that we can also address the three areas. This is more difficult and more challenging, but with the participation and the help of the municipalities and the different chambers, we are moving forward. We have been addressing this several times with the different chambers who have some influence in this sector. And finally, we'll talk about the new normal and the epidemiological risk spotlight, which will be enforced as of June 1st. This will be our new friend that will tell us who is going to be able to go out and who's not to the public space, and the how much activity there's going to be in society. This is what will keep us from having an important outbreak in the future. So thank you, and I can hear your comments. Now we also have here Maestro Alejandro Salafranca. He's the chief on dignified work. We've talked about this before, and he's also part of the team that we've been helping all on this in this situation with people in the Ministry of Economy. And well, tomorrow we'll have a more formal transmission of this. This is a technical forum, so we basically talk about technical details, and that's why we wanted to share this today. Now for questions and answers. Thank you, Dr. Gatel. Good evening, Saturnino Reyes, Diario Locutor. So very interesting what you just shared with us, and especially for the people and those companies. So I'd like to know, in terms of the report that you just provided, Dr. Gatel, in terms of the deaths, we know today that unfortunately all Mexico is COVID territory. So I'd like to know, and what, like talking about, we can say that the COVID is like has the gold medal here, and I'd like to know, maybe you don't have this information, but if you have an idea, I'd like you to share it with us. So what is the silver, um, what medical conditions are getting the bronze and the silver medals? Because we keep talking about the COVID related deaths. We've seen even some memes on social media about this. So we'd like to know today, maybe people are just talking about deaths by COVID, but they are forgetting about other deaths, other causes. And so we'd like to know in this period, so what are people dying from on top of COVID? And the last one, so in general, the death reports might say that you got infected in the streets, you just went out. So, but what happens with the people who are in the homeless? So those people, have there been any reports of deaths? How, are they coming to a hospital? Are they just out in the streets as if nothing's happening? Is there a decrease in the number of homeless people? We'd like to know that information, because those people are usually just immune, apparently, to other conditions, maybe because of their lack of hygiene or whatever situations in the environment. So if you can talk to us a little bit about this, and if there are any states with reports of deaths amongst these people. Thanks so much for these questions, which I think are very important. In terms of the fatality and fatality causes in Mexico, there's been a variation in the past few years, very little variation. They're usually the same, or they have been in the past 10 or 15 years. For the past 18 years, we have a clear problem with non-transmissible chronic conditions. The last number is from 2018 with the official rate. These numbers are provided by the INEGI. They are the authority, the national authority, they are autonomous authority that provide these numbers. In 2018, over around 730,000 people died in total, and the first 5 causes of death are those cardiovascular conditions, followed by diabetes mellitus, followed by some external causes, which are related also, of course, to violence, also GI conditions, particularly the liver disease. And I'm kind of getting confused here. So the third one is cancer or malignant neoplasia. The fifth cause is external causes, and then we have other causes. The eighth cause was influenza. 28,000, over 28,000 people died from influenza, a little bit over 28,000 if I'm not wrong. This is a really common cause, which is also together with pneumonia in the entire world. And this has been for the past 10 years or so, tens of years. Pneumonia is put together with some other causes because we cannot tell all the time if it is by influenza or not. Some other diseases, non-transmissible disease, those chronic disease, and there's also, it is very important in Mexico that in the past 12 years in Mexico, conditions related to malnutrition are also very common. Those conditions related to the overeating of sugars, salt, fat. This is one of the main causes of death in Mexico. In terms of homeless, adults, children, seniors, of course, the consequence, the natural this is a natural consequence in a polarized society with a lot of differences between social sectors and social classes. Of course, this results in a lot of people in a homeless situation, and these people um, are vulnerable in all senses, culturally, socially, and health-wise, and these are rejected people in a lot of senses. And unfortunately, for the health institutions, we have a great number of people who have been treated by COVID during this pandemic. A lot of homeless people, they don't represent a really high number within the sick number of sick people, and we've got different situations. Unfortunately, people who die, but also important cases of people who were considered to be on high risk status, and however, they actually were able to recover successfully. Next question, very quick. I was going over the numbers, the statistics, and we have a report that in Mexico there is a 77% of occupancy of beds and 23% of availability. In terms of ICU beds, there's also a 66% rate of occupancy. So when are we going to be talking about mm, we're we're getting closer to the saturation. So what's the next step in this status? Just this morning, the major in Mexico cities saying that there will be an increase of this of the disease, and apparently the Mexican people still won't understand about this. We're still having a lot of people going out in the public space, so people are not really following the measures, and we're now this obviously will result in a increase of the disease. So what's the next step here? This is very important. I talked about this every day. Mostly, we need the people to keep in mind that, and you have to share this message with at least 5 people to all those who are listening. Share it with at least 5 more people because not everybody's listening. Thankfully, we have people from the media who help us spreading the message, but if one Mexican shares the message with 5 more people that the social distancing campaign is not over yet, and that we have to continue with this, this is the only mechanism, an essential mechanism that will help us reduce infection. So people have to stay at home. This will keep us also from being active in the transmission. So when at some point we have reached a point when care becomes a little bit difficult, we've been far because we haven't reached even at 80%, even not even in Mexico City, which is a high intensity transmission area. maybe not all people can see these numbers. When we are getting close to that number, the 70%, we increase the capacity. If we get close again, we increase the capacity again. And how do we do that? With the retrofitting process, which is moving some resources, moving some procedures that are not essential, and use some temporary COVID units, just as the one that was open on the racetrack, with the help of the IMSS, and the use of resources that can. So the private sector is also could help here. So we're still far from this. We are still able to move and people without COVID symptoms, so that we can have more availability on the COVID centers. And of course, this is also getting our hands on some of the resources that are a little bit hard to get, such as the ventilators that we've been able to get timely, fortunately, so far. It's 20 o'clock. I wouldn't like to rush this, but we really have to end this today. This will be all for today, and we'll be talking tomorrow in the Pulse of Health with the president tomorrow morning.